we encourage our listener to get pen and paper if the chance is there, to jot down some few points, call during a time where the time will be given a call us, add on to our discussion, make your contribution wherever deemed necessary, and let's protect health, promote health in our environment. So let's go strictly into our topic because time is not in our favor. Clean water and safe drinking practices is the topic for the second edition of Field Health Hour here on Radio Kipamos. Once again, I'm Axe M. Blair Jr., one of the lead volunteers at Progressive Health Initiative of Liberia. So, firstly, let's get to know why this topic matters in Liberia, because we are talking about clean water. So, the point here is Liberia has repeatedly recorded waterborne diseases outbreaks, especially during rainy season, and those outbreaks are due to many reasons, some of which are flooding, open defecations, poor drainage, unprotected wells. So these are national public health issues. It is not an assumption. So those points that are just listed are reasons for which we have lots of outbreaks through waterborne in Liberia. So we'll look at clean water because we are discussing clean water and safe drinking practices. So what is clean water? Somebody will be asking. Clean water is a water that is safe and free from dirt. That water should be safe and clean from dirt, from germ and harmful chemicals. There are a lot of chemicals that are harmful to our environment, to ourselves, and even in our homes, and make our water we drink unsafe and also bad for our consumption. And then we limit this topic to Liberia because this is our country, this is where we are, and there's a saying that says, good thing always start from home and end abroad, right? So we need to start from our own country, tell ourselves what to do, talk to our people what to do before we extend out there. So in Liberia, many water sources look clean but are not treated. I don't know whether you believe that or you accept that. Many water sources, they look clean when you see them, but they are not treated.
They are not getting treated.
Yeah, how you look at that? Is it true?
Yeah, it's true.
Okay.
There's clean water, you can see, if you see the water, you feel that it's good, but they're not very clean.
It's not very clean, it is not treated, but through eyes you see them clean. So we are going to delve into that tonight. And then for example, during the Ebola outbreaks in Liberia, some part of 2014 to 2016, health authorities through the Ministry of Health, the county health teams in all of our 15 counties that make up our country, they emphasize that even clean waters will carry germs, and then which is why boiling and chlorination were strongly promoted nationwide. So we noticed that people were talking about you should boil your water, you should chlorinate your water. All these things were being said during the time of those pandemic in Liberia during 2014 to 2016 Ebola. And then let's look at the importance of clean water to our health. We're talking about clean water and safe drinking practices. So what is the importance of clean water to our health today? There are a lot of importance of clean water to our health. So we say clean water is essential to health because it prevents waterborne diseases. It supports proper body functions and help people to live healthily and productive life. Clean water it has power. It's a power to good health. And then clean water also keeps us healthy by preventing diseases and helping our bodies function well. So anything that goes into our body, especially water, we should not take them for granted. It is advisable, and we have come as health institution to also add on to the Ministry of Health, Enfield, Partner in Health, Maryland County Health Team, and other health institutions to tell our people that clean water is important in our environment, in our homes. To buttress their effort, because we understand that health is everyone's responsibility. And then Liberia's Ministry of Health, they regularly link child diarrhea cases seen at clinics to unsafe drinking water, especially during rainy seasons month, uh, densely populated communities. So, both at the level of our Ministry of Health, there are a lot of cases, child diarrhea cases. Those cases are then routinely linked with what? Unsafe drinking water. And then they said those diarrhea sicknesses and other things, stomach pain and other things that comes from water, they usually happen during season, and they mention rainy season, where they talk about flooding, and then they also talk about densely populated community where you found group of people. Yeah, too many people.
Too many,
Yeah.
and you make sure
Make-
to protect hygiene.
Hygiene, poor sanitation is among groups. So this is where they linked, and this is why ORS. I think you know about ORS.
Yes, ORS.
Okay, and clean water as standard advice in clinics. That's why they talk about ORS. They always tell you about ORS and clean water in clinics. They advise us.
Yeah, so but sometimes if you sometimes go to the hospital, normally they can say if you are feeling weak, they can ask you to take ORS and it's not the cost.
Yeah, ORS is also there to give you strength, and glucose. It gives you glucose in your body as well. So ORS is also advisable to take when the body is weak, because once you are weak, you need energy to be able to move from one point to another. So they ask you to take ORS, even some pills that has high level of power to break your body down to a certain extent. They tell you take the ORS with this pill to make sure that you will not be weak to a certain extent. And then providing the awareness on ORS, these are topics that we are going to break them down, because we have 48 topics for this year. So clinics, they advise us to take ORS and clean water as well. And then there are diseases that linked with unsafe water. There are other diseases. We are not going to name everything, but we'll name few. And then unsafe water causes diseases such as cholera. It causes diseases like diarrhea, typhoid fever, dysentery, and hepatitis A. So these are few diseases that are associated with drinking unsafe water. There are many, but we just want to name those few. And then for cholera, we talk about drinking water contaminated with human waste. It gives you cholera. And then for diarrhea, it's using dirty water for drinking or cooking. You come down with diarrhea. Our people come down with diarrhea. For typhoid fever, it is where you drink water polluted with sewage.
Yes.
And when we talk about sewage, we're discussing water that are coming from latrines, from different angles, polluted angles. Polluted waters. Thank you. Typhoid fever comes in. Then dysentery is drinking or using water with bacteria or parasite within them. You get dysentery. Then for the hepatitis A we talk about, is where you drink water contaminated with feces.
So
It could be human feces, it could be animal feces.
somebody might say, I always sometimes when I drink water, I always see my stomach, running. I always see myself running my stomach. What actually be the cause of that?
Yeah, sometimes when you drink the water, you notice that you run into the bathroom, to the latrine faster. It might be caused by some of those things we need. Probably you might have drunk water that contain bacteria and parasites. That is the cause. It gave you dysentery, or you might have drunk water, dirty water, or you cook with it. It also gave you diarrhea, and all those sicknesses we name: cholera, dysentery, typhoid fever. Typhoid fever is exempted a bit, but diarrhea, dysentery, all these things, it makes you to visit the latrine faster, because your entire system is not well anymore because of the water you consume.
Okay, so you mentioned about body water. Maybe somebody might ask, but I don't really drink water always. My water I drink always from the mineral side, and then always doing that. You talk about body water. So exactly, somebody who always drinking safe water, they may be drinking mineral or water, or normally they get sometimes they go in and very fast. How can you speak to that?
Okay. We have that in the discussion. Let look into it. We have the sources of our water we drink. When we get there, then we will lay emphasis on your question. So Liberia experienced cholera outbreaks, including during the 2017 to 2018 outbreaks. It was officially reported by Ministry of Health and World Health Organization. And these outbreaks were directly linked to contaminated water and poor sanitation, particularly during heavy rains. So most of the things derive from rainy season, during rainy season. So like what I just told you, the question you were asking, I think it falls on here where we have the sources of drinking water in Liberia. We limit this to Liberia because it is where, I think from the onset I told you, this is our country and we need to know what we need to do. So what are some of the sources of drinking water in our country here? So we have hand pumps, and those hand pumps, some of them are installed by maybe the NGOs or by government. And then we have open dug wells. There are other wells we dug in the community, but they are open. They are also source of water we drink.
Yes.
And then we have rivers and creeks. Rivers and creeks are also sources of drinking water in Liberia. Then we have rainwater harvesting. Like rain is falling, I just put my bucket there and collect. It's safe for you.
Yeah.
It's also a safe. Then we have pipe-borne waters. Pipe-borne waters are waters that probably I have my reservoir in my home, and then water is running through my home.
Yeah, through your home.
Through your home, in your kitchen, your bathroom, everything is a pipe-borne water. It's also a source of water in Liberia. Then we have sachet water, where you were talking about mineral water, bottled water. These are sachet water. So there are few sources that we name here, but those sources that we name, they have risks. They have associated risks with them. Each source have associated risks, and those risks, when we name those risks, then your question will be answered during the naming of those risks. So we just ask that you attentively listen. When we name those risks, you will know that some of those sources are not even preferable, and if they are preferable, there is something needs to be done to be more safer for more. Okay, well equipped. Thank you. So for some of the sources of water that we name, dirty surrounding may allow germs to enter. You getting that?
Sometimes you realize that your resident is not very conducive.
Thank you for that word, conducive. It is not conducive. You notice that your surrounding, when it is dirty, germs will enter into the source of your drinking water, and then animals, insects, and dirt can fall inside. Like where we talk about open dug wells.
Yes.
Once they are open and they are not covered, what happens? Rivers and creeks.
Rivers and creeks, and sometimes you see everything's getting into
Thank you. They fall into. It's like you are getting to know the risks that are associated with some of those water sources, and then human waste and open defecation. It is one of the things that embarrasses our health today in Liberia. Open defecation. It is affecting our water sources, most especially in our country, Liberia, because like the creek, the rivers, even the open wells we're talking about, my brother, the open defecation where we just sit and do what we saw, we mess the place and just leave.
Yes.
It is one of the harmful acts in terms of contaminating our water we drink. And then we have washing, bathing, and mining activities also pollutes the water. Well, I don't want to be specific with county names here, but there are other countries in Liberia where mining is effectively taking place.
Mining actually polluting, there are some other places. Even around yourself, there are other community, they're not very happy that's not safe area.
Thank you.
Yes.
Using latrine. So, like bathing, there are other rivers in our people drink today. People also bathe in the river, and they wash in the same river. In the same river, they are mining. So you see how contaminated the river is. You see how contaminated the source of drinking water is. It polluting the water we drink. And then we have broken and leaking pipe allows contamination. Like when we talk about running water in your home.
Running water,
Yeah.
maybe you have a pipe.
Yeah. The pipe-borne water.
You get a pipe, you put it outside, and then the water from your house, you get it running that
In that pipe.
and then you realize the water is going, in different dimension.
Yeah, and the pipe that is running the water directly in your home, the pipe is burst. Let's just say it has mag leakage, and then through that leakage, contamination is entering. And once the water is in a pipe, all you know is that the water is safe. Not knowing the pipe has leakage and contamination is passing through that leakage. So pipe-borne water can also have it can be contaminated through leakage of pipes. And then we have cold storage in heat. It can affect the water quality. Then you take out to the sachets of water, maybe the mineral water we drink.
Yeah, that's what I'm talking about.
Thank you. The cold storage of it, when it is too poorly, what happens? The heat. You know there are certain temperature water needs to be on, but you go low, the heat and other things affect the quality of the water. Then contamination comes in. So these are few. Open wells located near pits, latrines are common in both urban and rural areas. I don't know whether you have noticed it. Which of you have noticed?
Yes, sure.
Sometimes they say do that stuff with water, money, and sometimes see that for them.
Okay.
Yeah, sometimes the water will be too hot.
Okay.
And then you don't even know the time the water is staying.
Okay.
But then we are feeling like we are comfortable
Okay.
that we're drinking water from them.
Okay.
Or
So
buy for them.
yeah, then I asked, open well located near pits, like a latrine pits or a pit that is contaminated already, then you found open well there or near latrine. Come on.
Yeah, sometimes
yeah.
let me give you this. Sometimes you get around other communities.
Yeah.
And then you realize that community have a water, that you going into another water.
Yeah.
You get me? So in that process, you don't know that water that person using and that get into another water. You don't know who all using that water.
Okay. You have any contribution?
Yeah, I want to throw some light on. First of all, I'm Jim Tumuba Harrison. Some of the community that we live in, you will see, latrine will be up, and then you will see where it will be down. Yeah, it happening around. It happening around.
Yeah.
So in this case, you think what would be, the solution, to stop all these kind of things that happen around us?
Yeah, thank you. That's why we are here. That's why Phil is here, and that's why this program is here, to just enlighten the minds of our people and ourselves that this is what we need to do as community,
Yes.
as members living in a community. These are things we need to do to save ourselves. And then, like you said, you see the latrine up and the well is down.
Yeah.
These are things we are discussing, and we are going to dive into it. But what we need to do and what we need not to do.
Yes.
This is what the program is for. So during heavy rain, physical matters seep. The physical matter is seep into groundwater, contaminating wells. This has been repeatedly cited in public health assessment. So somebody may be asking, what is physical matter? The physical matter seeping into underground water, it means maybe human or animal waste that enter underground water, mainly during rainy season.
Yes.
Yeah, or it pass through the soil and then it enter the underground water, usually from latrines, like what you said, open defecation or leaking sewage, making wells and pumps unsafe for drinking. So most of those things happen during rainy season, because it is rainy season. During rainy season is where you see the water will just overflow and water plenty in the community.
Yes.
Yeah.
Yeah. Just all about.
Yeah, and some waters are even uncontrollable.
Yeah.
Okay, so when this thing happen, you notice it. And then let's move, making water safe. Let's see what we can do to make our water safe. Yeah, because we have discussed some of the contaminations, what causes contamination, sources of drinking water, and what have you. So let's discuss how we can make our water safe. Yeah, how can we save water? Thank you. So one of the ways that we have cataloged here and would like to advise on, to provide awareness on, is boiling water.
Boiling water.
Yeah, to boil water. So boiling water has been officially promoted in Liberia for decades now.
Okay.
Yes, Ministry of Health, Maryland County Health Team, Nima County Health Team, Grand Coup County Health Team, and the list goes on. Enfield, PRH, I always call their name because these are big health institutions. They have been preaching this over and over, and they're still preaching it out. Boiling water is one of the official ways of saving water. And even UNICEF, NGOs, numerous of them, during outbreaks and emergencies, they tell us to boil our water. We advise everyone and ourselves to boil our water at least 1 to 3 minutes. 1 to 3 minutes. And if you boil the water, while you do this, you let the water to cool. You cannot just boil the water and begin to drink the water. You will kill yourself. So you let the water to cool. When the water cool, letting the water to cool is another thing. Where the water is going to be cool is another thing. So we also
Let me come to something. Yeah. If for instance you want to use the barrel, and then you boil your water, me as example we can say I want water to be very hot or cold. So in a period of time, will you be able to cool again before using the barrel?
Yeah, we will come to that. Even the water you boil, this one we are discussing is water that you will drink. The water you will drink, it can also be boiled. That's why we're discussing. You need to boil the water you drink also, if you want to do that. And then it is also advisable to do that. And then when you boil the water, like the minutes we talk about, 1 to 3 minutes, it could be 1 minute, it could be 2 minutes. Because when water is boiling, when you notice when you open a pot and load there, you will see some bubbles on the water. When the bubbles are there, meaning water is boiling strongly, very high. Now you know the frequency at which the water is boiling. So you can take the water from there and cool the water. But the water to be stored in a clean cover container. That boiled water should be stored in a clean cover container and use a clean cup or ladles. Ladles are those materials we use with handles. That we don't advise that you dip your hands into those water. When you boil the water and place it in a container, then maybe you allow the child or yourself to dip your hand in the water again to drink. Because your hand itself, when it is exposed out, is getting contaminated on a daily basis, on a second basis. On a mini basis, your hand is getting contaminated. When we were here doing our last presentation, we talked about washing hands. We discussed it and we went in depth. So when you store the water in your clean cup, in your clean cover container, you use clean cup or ladles. Don't dip hands into those water that you will boil because you want to save yourself. And then another way of saving water is through filtration. So like you want to filter this water, to filter the water. So filtration during rainy season, water often becomes muddy. Not to say the water is completely a mud, but you will notice that the water color will be brown. Yeah, you will notice when something is getting. Thank you. So and those things happen during rainy season. So when you notice that the water is getting muddy, what you do? You filter the water. That's where filtration comes in. And then when you filter the water, what happens? It is good we practice cloth filtration to remove visible dye before further treatment. Filtration cannot take germ from water. It cannot take bacteria from water. What it does, since the water is muddy a bit,
it can really reduce the mud.
Thank you. The physical dye, there are other physical dye you will see within the water. Filtration reduces them. And we advise that maybe you don't take your shirt from the shirt that spend a whole day on, you take it, you filter water away, no. The lapel you wear the entire day, you take it, you filter water away, no. We don't want to advise people to do that. Maybe you buy a cloth, a towel, not bathing towel, but a clean towel. It could be a bigger one, it could be a clean lapel that is kept safe. You see, I'm using a lapel or this cloth for filtering my muddy water. But mind you, when you filter it, don't just drink it, because it is not yet safe. So after filtration, what happens? Filtration only removes particles, not germs. This is why health workers always advise boiling or chlorination afterward. And then we want to explain this in detail. Chlorination is different and then boiling is different. But we don't want to advise you to boil the water and also chlorinate the water at the same time. You choose one of those methods. If you filter the water with the cloth, you decide to chlorinate the water, is enough. If you decide to boil the water, don't chlorinate the water, because two of them are not necessary to be done. You have to choose one option. If you chlorinate the water, you wait for 30 minutes and above before you drink the water. Don't just chlorinate the water and start drinking the water. It'll, mind you, something that's good for you,
It can also
do you harm.
Yeah.
So when you chlorinate the water, the advisable minutes is 30 minutes. Yeah, if you like, you wait for 40 minutes, 35 minutes, no problem. But nothing less than 30 minutes before you drink chlorinated waters. When you boil the water, as I said earlier, what you should do, I think you guys are listening.
Yes.
You cool it, right?
Cool it.
Yeah. Where you cool in it, it should be in a clean container that is covered.
Yeah.
Thank you. And then you drink your water. So chlorination news became nationwide behavior during the Ebola outbreaks. I think I talked about 2014 Ebola outbreak.
Yeah.
To chlorinate water.
Yes, why people using chlorine.
Thank you.
Where
Thank you. In the entire country, chlorination became nationwide. You understand? Chlorine buckets at home, schools, and market and offices. I think I was sitting and have some at my house. Where when you get there, you need to wash your hands first before you even.
yes, even in Ebola time,
Yeah.
they were distributing buckets.
Yeah.
On the road campus, in the homes.
Yeah.
Where before we come out, you
Yeah.
have to wash your hands before you see any other thing in your house.
Yeah. And then during the COVID-19, it also happened again.
So, but during this time, we are not seeing this thing around.
Yeah, this is where this program come into also, because we need to conscientize people, we need to talk to people to continue. Washing hands is very effective and good for our health. It's important. We should not wait for outbreak of diseases before we wash our hands. But I see people taking those things from their homes. Other people they say about Ebola gone, COVID-19 finished. Then why I stay washing my hands for? So this is why we are here, for all of us to rally hands around each other and tell our people the necessary ways and do's and don'ts of these things. And then water guard and chlorine, tablets. They have tablets for the chlorine. They got water guard. I think you guys know water guard too. It's also good for news.
Really, yes.
Yeah. So water guard is when you visit a health facility, you say I need water guard. They are there. They are going to give you some. They will teach you how to use water guard, and then when they give you the chlorine tablet, they will also teach you how to use the chlorine tablet. When you carry the chlorine tablet, they will tell you how many pieces, how many dose needs to go in certain liter of water, and then how many minutes you need to wait for the tablet. So these things cannot be done if you want to use water guard. You want to use the chlorine tablet. You cannot take this decision yourself. You need to visit the health facilities, because programs like this, we only provide awareness. We cannot diagnose sickness or something. We tell you what to do, and we are here to just tell you anything you need to do. Visit the health facilities, because it is where trained guys are to tell you. Our doctors are there, our nurses are there. These are people who went to school for these things. Yeah, to make you understand. Yeah. And then let's run it out for the chlorine, like I said, 30 minutes after chlorination before you use the water. And then for combining methods, if you want to combine a method like filter muddy water and then boil or chlorinate, you choose one. When you filter, like I say, if you filter the water, either you boil or you chlorinate it. But don't chlorinate and boil. It's like double negative now. You making the water will be tasteless, colorless, all kind of thing will be in the water. Two substances, okay. So you can boil the water. Choose one, and it will be suitable for your health as well. So this guy comes from National Emergency Health Protocols. It's not our own opinion, but it came from the National Emergency Health Protocol. And then even treated water can become unsafe due to a lot of things. Those water that you treat, they can also be unsafe. And why they can be unsafe? Sometimes open container. You boil the water, you allow the water to cool, then you put the water in bucket. Bucket are open. You put the water down there. What happens? The water becomes contaminated again. It becomes unsafe. Share cups. I finish drinking, I give a call to drink, I get a call to John Brown. Everybody in the community sharing it. Everybody in our you see that same cup over and over moving up and down. Share cups. It also make treated water to be contaminated and unsafe. And then children dipping hands. Your son just from playing outside there. You even get time and just jump inside. No. You start dipping in the water. The water that is treated, the water that is chlorinated already. They begin their short hand inside. The water is unsafe for drinking.
Okay, let me quickly come to this question.
Yeah.
You talk about water saving. Let's look at the aspect of well water. We say pump water and also mineral water. Which one it is actually very safe? I think it can be useful with using pump water and mineral water.
They both are safe for consumption.
But you don't know where the mineral water they are getting it from, then using it. That would take them bring it around.
Yeah, like those of us who live in a city, this is why it is advisable. Probably you visit a site of our river water station, know how the water is maintained, how the water is produced. Once health is your own responsibility. Your own health is your own responsibility. You need to go to the site, know how this water is produced, how this water is maintained before it is distributed in our community for consumption. So when you know them, and then you will know which factory, because there are a lot of mineral factories around, then you will know which factory is taking medical precautions in terms of maintaining their water. Yeah. Then even a pump, there are other, you know that we can chlorinate a pump, right? Pump can be chlorinated. There are other pumps, but other pump in pump, we say. Yeah. So pump in pump. When you see pump that is in pump, you know, and you exempt yourself from drinking because your health is your own business and it is everyone's responsibility. So you need to take steps because when something enters your system, you don't have control on it anymore.
I want to ask my question also.
Yeah.
Say indeed, I don't know, the way the factory producing their water, it may be necessary for me to buy my water sack and then carry it home and open it and pour it before drinking it. It may be necessary.
There comes in another situation that it will be hard to handle. I advise you to probably go to where the water is produced because mind you, if you go and then decide to open all of the mineral water, put it in container again for boiling, import for boiling, and then place in container, another thing will happen along the way.
You don't know what are the container you are putting.
It's more whether it's not even safe. But if you know that you will follow all of the preventive measures in boiling that water, it can be advisable for you. But wherein you are not going to be very careful with it, then you just go to where the water is produced. If you have little advice, you give it to them. Something that is not good is being practiced, then you tell them. And then health workers consistently emphasize on covering your container during community sensitization. When health workers go in the community, like Progressive Health Initiative, like bro, if our volunteer want to visit a community when we get there, if we go there to talk about water and sanitation, personal hygiene, other things, where we are, we tell you. So health workers, like Maryland County Health Team, when they go in the field, in the communities, they tell people, during their sensitization for communities, they tell people, cover your water before you drink them. Put your water in clean buckets, in clean containers, bucket with taps or faucets. You know what a bucket has faucets? When you turn it around, then you just get your water through the cup instead of opening the bucket and shoving the whole cup in it. So these are topics and discussion people been telling people in the communities. And then water handling, how to handle your water. Because in crowded household where people plenty, dipping hands or cup into storage container has been identified as common contamination points during community health education session. They always told people that we have 15 persons in this house. Everybody drinking from that same drinking bucket. When I take the cup straight out in the bucket, my brother shopping it there, my sister shopping it there, contamination is all in that particular water we are drinking. Then we look at hand washing and water safety, because we already discussed it. But during the COVID-19 Ebola pandemic, we understand that hand washing with soap became national issue where everybody in Liberia was taught how to wash your hands with soap and water. And then we were also taught during the Ebola period and again during the COVID-19 period. The same hand hygiene practice we want all of us to apply today by protecting our drinking water is just a continuation of what we have been told to do or what we have done in the past. We are not discussing new idea here. The same way we wash our hands, the same way we protected ourselves during COVID-19 and other things. That's the same thing we are discussing. And then there are other lies. We call it myth and reality and call to action before we conclude. There are other lies about these things. Some people, we have common beliefs. You will be talking to somebody to wash their hands, to protect their water before drinking it. Somebody will tell you, say, this is a belief. They will tell you, say, we have been drinking this water for years now.
Yes, from our former
we've been drinking water, nothing been happening.
to us.
This is a belief. This is now established fact, that belief. But who told you that water you have been drinking for years is not affecting you people? Yeah, who told you?
But this is our tradition.
Yeah, so the reality is water quality changes over time. The quality of the water we drink, it can change anytime. And there are factors that are associated with the changes of water, the changes in water quality. One of them is seasons, rainy season and dry season. During the summer, during winter, water quality changes. Then flooding, we know about flood, right?
Exactly.
Flood can also change the quality of water. Quality. Then we have population growth.
Yeah.
Population growth also change. But maybe somebody might be there and say, well, what did population growth get to do with water?
Yeah.
But it has something good to do with water because population growth affects water quality in several ways. One of the ways it affects, more people equal what? More waste.
More waste.
When the people are many, the waste become what? More. It increase.
Yeah.
So it also do what? It change the water quality. Increase use of water source. Like maybe 10 person were joining to this pump, but now the community has grown. More than 50 person going to the same pump. You can't even tell the other person to stop carrying slipper in the pump anymore. The pump is contaminated.
Even the water say, or when 2 person drink water, you see the pump will be clean.
Yeah.
But one above 2, 10, 20 person drink in that same water, you see
The pump start getting dirty.
The pump
The water color start changing. Okay. Poor sanitation in crowded areas. One, the community has too many people. The sanitation level there is not too strong anymore. And then more farming and chemicals, etc. So population growth also it helped to change the quality of our water. So this is confirmed by repeated disease outbreak in crowded communities and regions. So we have our little call to action before we end. We say boil your water or you chlorinate your water during rainy seasons. We advise for you to do that. And then we say protect your wells. And the protection we're discussing, it should not be just to cover the well. You leave the well, inside the well is just green. There's a green slippery thing, we call it Spirogyra.
Yeah.
That thing is very bad. It living within the water and then you just cover the water. It is not advisable. Clean in the well also and cover the water. This is the protection we are discussing. Chlorinate the water. And then keep latrine far from water sources. Don't dig the well here, then you put the toilet, like what my brother was saying. The toilet up, then the drinking water down. Then you say you safe. And then practice hand washing consistently. Hand washing, it is something good. Practice it consistently. And then before we give our closing message, we would just like to stop here and then we open the line. Maybe our listener would like to make some little contribution. Thank you for now.
Okay, so that's it. For those of you
who live in the interior, I live in the interior before, and we did all these things. So in the interior, we talk about boiling water, right? This is advisable for mainly the interior people, because if you get the water from the creek, the water is muddy already, especially during rainy season. The various creeks and rivers, the color changes, and then you see a little bit muddy. You filter them and boil them, and then look for your container. Container, close them up. Be safe. Maybe you look for a bucket that is tapped well. with a faucet, and then you put your boiled water in it. And living in the interior does not exempt you from coming to the city. Those who in the interior can come to the city. They can see something. They can visit health center. Ask for chlorine. The health center will give you chlorine. Ask for chlorine tablet. They will tell you when you go to, even if you don't speak English, they have Grable health practitioner. If they have Geo health practitioner, any other data you speak, they have somebody from your data who is a professional. They will tell you what to do with that tablet. You carry that chlorine tablet. They will tell you what to do. So those in the interior, my brother, they are not exempted from this, saving themselves from drinking safe water as well. Yeah. So I think I want to give my parting statement. Filtration can take place also, because when the water boils, it is also good, so it can be filtered. But mind you, the cloth you are using should not be cloth that you use. Maybe the laptop that want you, for example, or your shirt. It should be clean. It should be well protected. And then because our country, Liberians, we have faced deadly diseases, before, and we survived them. Like the two pandemic we faced, Ebola and COVID-19, they were deadly, but we survived them by changing our behavior. The same way we are here tonight talking, that's the same way our health practitioner came, our Ministry of Health came. They talked to us, do this and you will be safe. And we did them to choose changing our behaviors, and some of us survived. We survived the entire period. So we have come this evening to add our voices to all of those that have been speaking out there, that health is everyone's business. And the motto of Progressive Health Initiative of Liberia is health is life. Because without health, you cannot live.
You cannot live.
So in getting this health, you need to make the health to be safe. You need to protect yourself. So clean water and safe drinking practices are not new lessons. They are proven life-saving habits. So at Field Health Hour, it is where we use knowledge to protect life. Thank you very much once again. I'm Aze Mbele Jr.